Hello, I'm Abby. I'm 21 years old and I'm a senior healthcare assistant at the moment doing my nurse training. As you can probably tell from the description, I'm going to be doing a series of videos on neurofibromatosis. I'm going to be looking at type 1 and type 2, as well as all the symptoms, how to look out for it and all that kind of stuff. So I have a diagnosis of type 1 neurofibromatosis. I'm going to go into a little bit later about what that is and all the technical, scientific, biological side of it and whatnot. I'm actually quite grateful with my diagnosis. I've been very lucky not to have any severe learning disabilities or any large tumours or anything like that. So in these upcoming videos I'm going to be covering all sorts of things. I'm going to be looking at appointments that you need to go to when you've got NF, appointments I've had, appointments I've got coming up. I'm also going to discuss neurofibromatosis and pregnancy, as I know for a lot of people with NF that's a very tricky subject. I'm going to go through risks, different types of tests you need prior to the birth of the baby, things to consider and all that kind of stuff. As well as once I become pregnant, I'm hoping to do some videos on tracking my pregnancy with NF so you guys can see what it's really like, what really happens, and it's not all based on just leaflets, and it's a real one-to-one of what it's like to have NF and be pregnant. Okay, so I'm going to look into what neurofibromatosis is. So the NF is caused by a mutation or like a spelling mistake in one of the genes. The NF1 gene, which I'm going to first discuss, and then I'll talk to you about neurofibromatosis too, is gene responsible for producing the protein that helps regulate the growth of nerve tissues. The protein effectively switches off and the growth of the tissue once it has reached a certain size. However, the mutation causes this to become a bit scrambled up and a bit confused, and it then leads to the producing of an incomplete protein. It is so much less effective at switching off the growth of the nerve tissue, and this is how it leads to multiple tumours developing on the nervous system. People with NF tend to have kind of quite similar symptoms. So to first diagnose neurofibromatosis, you have to have 6 or more cafe lays, which I'm going to show you a picture of now. Also, what is present with a new diagnosis of neurofibromatosis 1 is something called neurofibromas. So these are little tumours that the nerve tissue has essentially not stopped the growth of. There's lots of different there's 2 types. There's kind of ones that are all dotted around the body and whatnot, and sometimes people have them kind of like a band all in one place. It can really vary. I'm just going to show you a picture of what some of my fibromas look like. So, as well as the physical attributes that can give away a diagnosis of neurofibromatosis, there are other things like sclerosis of the spine, which is like curvature in the spine, which can be quite uncomfortable sometimes. People can get quite bad back pain with it. It's not always noticeable. Other things like mild learning disabilities. It can vary from kind of like mild to quite severe. It can be anywhere on the spectrum really. As well as, although they are physical, you can't always see them that clearly. People have the lumps under their skin, so they're kind of like hard lumps under the skin, but you can't always, of course, see them as well as you can see the neurofibromas. Freckling is very common in neurofibromatosis. a person with a diagnosis of neurofibromatosis type 1 will have freckling in the armpits and the groin area. I have freckling under my neck as well as under my arms and kind of in my legs and on my pelvic bone. I'm going to show you what some of that freckling looks like under my arm. It looks like lots of little cafe lays, but it looks very freckly, but I'll show you. Okay, I'm now going to look at neurofibromatosis 2. I'm afraid my knowledge on NF2 is not as good as my knowledge on NF1 as my diagnosis is for NF1. But I've done some research on it. NF2 is a lot rarer than NF1. I think it's 1 in every 35,000 people have a diagnosis for it, so it is quite rare. It's completely different from neurofibromatosis 1 because it can cause completely different symptoms and how it affects a person, but it's the same. It's similar because of the genetic mutation in the gene or the protein. So neurofibromatosis 2 is of course caused by a genetic mutation like NF1, and the gene is called the NF2 tumour suppressor gene. Excuse me, the NF2 gene produces a protein called myelin. The myelin plays an important role in regulating the growth of these nerve tumours. It effectively switches off the growth after the tissue has reached a certain size, similar to NF1. However, because of the mutation of the instruction, the cells become re-scrambled and confused. This means that the cells produce incomplete version of the myelin protein. As a result, the protein cannot work properly. Alternatively, the body does not produce the myelin protein. In this case, incomplete or missing protein cannot switch off the growth of the nerve tissue, and this leads to multiple tumours developing within the nervous system. A lot of people with NF2, when they get their tumours, they can get them on their spine and on their brains, and they're usually benign, but of course there is always that chance that they can become cancerous, but they're all usually benign. People with NF2 can have problem with tinnitus, so that's like the ringing in the ears. They may be giving hearing tests when they're young to check their hearing isn't completely impaired. Problems with sight. Depending on the severity of the NF2 and the tumours, they may have mobility problems. But there are all sorts of tests that they do to see the severity of the NF2. Usually brain scans and MRI scans are done when a child is young and NF2 is suspected, and that is a sure way of being able to diagnose it. Thank you guys for tuning into my video. I hope you found it helpful. I'm going to leave my email address so you can email me if you've got any questions or anything like that. I'm afraid I'm going to disable comments just because I expect some people who don't understand to put something rude and inappropriate, so I've disabled comments. I'm really sorry guys. But yeah. But if you want to email me if you need any questions at all, please don't hesitate to ask, and I'll try and answer them as best as possible. Video responses and that kind of stuff. In the next video, I'm going to be looking at appointments with dermatologists and appointments that I had to attend as a child and I'm attending now. And in further videos after that, I'm going to discuss tests needed throughout pregnancy. I'm going to dive straight into that. I'm afraid I'm not pregnant, so I can't start the NF pregnancy diaries completely yet, but I'll keep you all updated and I'll give you all as much information as I can get my hands on. Thank you, bye guys!